Being a helping professional is rewarding, but it can also be very taxing. Likely you've heard the term burnout before. You can experience burnout really in any endeavor, any profession, but burnout is also a risk for people in the helping professions. What does burnout feel like? It feels like a lot of things. It can often feel like low energy. It can feel like a loss of interest in things that, especially the work that you previously had interested in. It can also feel like what we call compassion fatigue, where maybe you've gotten into the helping professions because you are naturally a very compassionate person. You want to help people. But because you're so taxed and so burned out, your well of compassion starts to run dry. This can be caused also by something we call vicarious trauma, where the traumatic content of what your clients are going through actually causes some trauma in yourself. Other complicated things to experience, to navigate as a helping professional: transference or countertransference. Transference is this psychoanalytic term that refers to when your client transfers on to you a relationship dynamic that they have with somebody else. Think about somebody who has an adversarial relationship with their father. You represent some kind of father figure as the helping professional, and they start to have an adversarial relationship with you, not because of anything in particular that you did, but they're transferring that on to you. That can also happen the other way around, where as the human being that you are, something happens in your client, they do or say something that reminds you either consciously or subconsciously about a dynamic you have with somebody else. And so that's what countertransference means. You pass it on to them, and they don't necessarily deserve it. In our courses, we talk about these variables and how they can be especially difficult and likely in psychedelic-assisted therapy. There are some things in psychedelic-assisted therapy that make us especially vulnerable to compassion fatigue, burnout, vicarious trauma, countertransference, and in our clients, transference. The long session days. You're sitting with people for a long time, and oftentimes they can experience varying degrees of intensity, emotional intensity, perceptual intensity, and they can need a lot from you. And that can be taxing if you don't take good care of yourself. So long session days, working with a co-facilitator can be really rewarding and awesome and relieving. It can also be challenging if the dynamic just isn't quite right. So these are some things you want to pay attention to if you're interested in getting into this field, if you are in this field, and things that we cover in our Fundamentals of Psychedelic-Assisted Therapy course.